It's called prior authorization. Here's how it works. Before your doctor provides a treatment, your insurance requires them to prove it's necessary. This is often a time-consuming process that can cause dangerous delays.
I'm sorry, your cancer could be cured, but we need to wait for the insurance company to approve your chemotherapy.
If you've ever dealt with insurance, you know the frustration of navigating the prior authorization process. It's a bureaucratic nightmare that often leaves patients waiting for crucial treatments, for surgeries, and even medications. Prior authorization is a process which health insurance companies require pre-approval for clinical treatments or services before covering their costs. This prior authorization process is supposed to ensure that patients receive the appropriate, evidence-based, and cost-effective care. But in reality, it's become a barrier to access driven by profit motives rather than patient needs. In this video, we're going to talk about that. What's up, everyone? I'm Dr. Antonio Webb, a board-certified orthopedic spine surgeon here in San Antonio, Texas. I've been in practice for almost 5 years, and throughout these years, I've seen firsthand how this prior authorization process is broken and extremely time-consuming. And it's just not in spine surgery, it's across all disciplines and specialties. This also includes simple things like medications that we tend to order. For example, when a patient goes to the pharmacy to fill a prescription, they are often told by the insurance that they won't pay for the medication unless a physician obtains approval. Patients may wait days, weeks, or even months for a necessary treatment or medical procedure to be scheduled because physicians need to first obtain authorization from the insurance company. This tactic, used by insurance companies to control costs, is called prior authorization. Studies have shown that the number of prior authorization requests has skyrocketed in recent years, leading to delays in patient care and increased administrative burden for healthcare providers such as myself. Behind the scenes, insurance companies, they have this complex algorithms and opaque criteria to determine whether a treatment or medication will be approved. And all too often, these decisions are really influenced by financial considerations rather than medical necessity. Sometimes these procedures, these treatments and medications are recommended. Really, the thing responsible for that denial is a bot or AI system. United Healthcare, they're one of the largest healthcare insurance companies in the US, and they were recently sued for allegedly using an AI algorithm to override doctors' judgments and wrongfully deny critical health coverage to elderly patients. What's even more disturbing is that it was said that this AI model that they're using has a greater than 90% error rate. And the sad part is United Healthcare continues to use this flawed AI model because so few patients typically appeal any of their healthcare insurance denials. When a physician is actually assigned to your case for approval, that doctor who is responsible for giving the approval may not even be in your specialty. As a spine surgeon, I've spoken to pediatricians, internal medicine doctors, GI doctors, just random doctors about my surgery approvals. It's crazy because when I spoke to the pediatrician about a particular case, she had really no idea about the type of surgery that I was asking to be performed. And my surgery was denied. And really, I had to tell the patient there was not much that I could do at that point. Another particular patient that I can remember in the recent months that I had to deal with insurance and authorization was a patient that I planned a staged or two-part operation. This means I stage the operation, I'll do one part of the surgery on one day, and I'll do the second part of the surgery on a separate day to prevent a really long operation because this patient had a prior surgery, they had a fusion that didn't fuse, essentially failed back syndrome, failed back surgery, and I had to correct the problem. So I was able to do the front part of the surgery. I went through this gentleman's belly, this abdomen to do an A-lift or fuse from the front. I had to pull out some hardware that wasn't fused and I pulled it out from the front and he did well. Ultimately, I ended up getting COVID. I had to stay at home for about a week, and this patient, I didn't want him sitting around in the hospital, so I sent him home. And after coming back to work, I asked the insurance company to change the date so that I can complete his operation, the second part, which is the posterior aspect of the surgery. And come to find out, they denied that part of the surgery. I was really confused about this because the insurance company gave me approval for both surgeries before I even started. And when I had to change the date, they denied his surgery, saying that he needed to go to physical therapy. Usually when this happens, I get on the phone, do an appeal, talk to the surgeon that works for the insurance company, and unfortunately, still didn't work. I talked to the surgeon. He said that the insurance company wanted this patient to go to physical therapy, even though I completed one part of his operation already, which just blew my mind. So having patients get denied surgeries for things that we're trying to do as surgeons, and most of the times it's either an AI bot or a physician that's not even within your specialty. And the big problem is that this is not just specific to my specialty. More than 1 in 5 cancer patients report not getting care recommended by their doctor because of these delays or denials. And that's a big problem.
New York Times Opinion interviewed more than 50 doctors and patients. Their experiences suggest that insurance companies often weaponize this mundane process in order to control doctors and inflate their profits.
If they deny care or they delay care, that's money the insurance company gets to keep.
The way that they profit is to deny care.
As prior authorization has spread, delays in care have become normalized. So have tragedies. 1 in 3 doctors say that it's caused a serious medical issue or even the death of one of their patients.
If you're lucky enough to live in one of just 2 states, Washington or New Jersey, you are protected from these delays. If you live elsewhere, you might not be. More states and the federal government need to follow Washington and New Jersey's lead because both patients and clinicians are being actively harmed by insurance companies using prior authorization to put up barriers for this much needed care. We all know that this whole prior authorization process is costly, inefficient, and responsible for patient care delays. It's time to hold insurance companies accountable for their role in perpetrating this broken system. Patients deserve better. They deserve timely access to the care that they need without the unnecessary obstacles standing in their way. So if you're a patient or even a provider, this is what you can do to address and mitigate these challenges. The first thing you should do is understand and learn about the prior authorization process. You want to familiarize yourself with the insurance company, their prior authorization requirements, procedures, and timelines. This includes understanding which services or medications require prior authorization, how to submit requests, and the expected turnaround for approval. Secondly, documentation, very important. You have to document medical necessity. And what does this mean? Well, providers, we play a huge and crucial role in documenting the medical necessity of the requested service or treatment. Your physician should ensure that all relevant clinical information, including the patient's history, symptoms, diagnostic tests, and treatment plans, are accurately documented and submitted with the prior authorization request. If you have clear and very thorough documentation, this can really strengthen your case for approval. You should also communicate. You want to communicate with your insurance company. Providers, we can proactively communicate with insurance companies to really expedite this prior authorization process and address any questions or concerns. This may involve contacting the insurance company's utilization management departments, discussing the clinical rationale for the requested service, and providing any additional information that they may need. And you have to understand, this is very important. In cases where prior authorization requests are denied, you as a patient or even providers, we have the right to appeal their decision. Providers should review the denial letter carefully, identify the reason for the denial, and gather any additional supporting documentation or evidence to strengthen the appeal. And this is where they're really banking on you not to do, because a lot of people, they just don't know that they can appeal a denial or just don't do it. By taking proactive steps to understand this prior authorization process, communicate effectively with insurance companies, advocate for medical necessity, appeal denials when necessary, and utilize available resources and support services, patients and providers can work together to address this prior authorization issues and really ensure that patients receive timely access to necessary medical care. I'm Dr. Webb. Thank you for watching. Please like and subscribe. I'd like to hear from you guys also in regards to any of your experiences with insurance denials and authorization. Put it in the comments below. I would love to hear from you.